Hi students, I am Dr. Badrinath and in this video we will see the pharmacology subject, the topic endocrine system, endocrine, the end. In the beginning itself the end comes, endocrine, that is a keyword here, end, E-N-D, end is the keyword in this topic. Endocrine system releases the number of hormones, various hormones. All the hormones very small in quantity. See, liters hormones will not be secreted daily in our body. Only a small quantity will be released. Okay. But however, it shows the very bigger performance, permanent action, permanent effective action, it will be shows on the body. Okay, generally we will think that hormones are very small quantity, nothing will happen with that. Everything will happen with hormones only. That point you have to keep in your mind very strongly, right? This is the endocrine system of a human body. So first one, here you can see the hypothalamus along with the pituitary gland. Hypothalamus also secretes the hormones. Most of the students, they will start with the pituitary gland. Okay. But both are side by side only, just up and down, hypothalamus as well as the pituitary gland. Okay. Next one, see here, thyroid gland and parathyroid glands. Both are same here. So just like a couple, here you can see hypothalamus and pituitary gland. Here thyroid gland and parathyroid glands, which are there parallel with the thyroid gland. That's why it is called a parathyroid gland. And next one is adrenal glands. Adrenal. See, name itself indicates it is present on the renal system. That is present on the both kidneys. Two glands are there. Pair is there, called as a adrenal. Renal. That is the main key point here. Adrenal. Next is pancreas. See here, which is present at the center part, is called as a pancreas. Next is ovaries. See here, these ovaries are present in the females, female reproductory organs. Both ovaries, two ovaries will be there. This is the uterus. From the uterus, both sides you will get each one ovary. So pair will be there. And a testis. It is a part of male reproductory system. And this testis also secretes the hormones. So all our body functions, major functions, will be done by the endocrine system. Endocrine gland secretes the hormones. All these are called as a endocrine glands. Very important point. Yeah, here you can see why we are calling it as a end. Why the name calls END, end. See, glands are divided into two types. One is exocrine gland and endocrine glands. Name, see here, endocrine gland, exocrine gland. See, our topic is endocrine glands. These endocrine glands only secretes the hormones. Okay, exocrine gland not. That keep in your mind. That is very, very important point. That's why here I compared the both side by side. What is endocrine system? What is exocrine system? Hormones I have mentioned here. Hormones will be secreted by this system. Okay. See, these endocrine systems are a ductless. They do not have any duct. That's why it is called a direct end. See, starting point is here and the ending point also here. That's why it is called as a endocrine system. See, endocrine tissue. This tissue directly secretes the hormones directly into the blood. There is no pipe-like structure. There is no duct-like structure. Direct secretion. All what we saw the glands, all endocrine glands doesn't have a ducts, doesn't have a tubes. That's why all are called as a endocrine glands or endocrine system. These are the features. See, these are the cells. These are the blood vessels. Side by side, both are side by. See here, blood is flowing like this, and these are the vesicles, cells, all endocrine tissues, which secretes the hormone directly into the blood. These are called as a ductless glands, secretes the hormones, secretes into the blood or into the lymph nodes or lymphatic system directly, mainly blood, and located away from the target. See, target cells are somewhere, okay, and releasing cells are somewhere. There is a distance always, okay. It travels through the blood directly, whereas a exocrine gland, this is the structure. Here you can see the structure. You can find a duct here. Duct means nothing but a pipe like a structure. It is a pipeline. See, first of all these cells called as a exocrine cells, which secretes the fluid here into a cavity like structure. Okay, and it is passed through a ductless and it is a secreted. Here total secretion will be there, which is away from the blood. That is the important feature of the important difference. Here directly secreted into the blood, but here it is not like that. It secretes via the ducts. Secretes a variety of things from enzymes to the mucus, not the hormones, and secretes onto the epithelial surface like this. Epithelial cells will be there, epithelial surface will be there onto the cell surfaces, located over a target. Example is gastric juices. Various gastric juices will be secreted through the or exocrine glands only. See, this is the syllabus of as per your university. In this chapter, basic concepts in endocrine pharmacology. The topic what I have highlighted with the reading that we are going to be observe. Pharmacology of drugs acting on endocrine system. We are not at all bothering about the exocrine system here. And hormones, it's a word derived from the Greek. That's why I mentioned here green ink, okay, to keep in your memory. And he is the Aristotle, guru of Alexander. He is a Greek. That's why I kept the, for easy remembrance, I kept the Aristotle. Alexander, you know very well, who conquered the entire world except India. Okay, Greek word harmein. This is the Greek word harmein. Okay, from that hormones English word came. What is the meaning of it? It meaning stir up, stir, S-T-I-R, stir up, something to cause to feel a strong emotion. That's why it is showing a hormone shows a very strong, very powerful action on the body. Causes a feel a strong emotion and a desire, very strong desire to do something, to do something. Okay. A great word. Hormone means it is really a great word. Okay, strong desire. Hormones regulates the all body functions, not only one or two like that. Many major body functions will be done by the hormones. If there is any hormonal imbalance in the body, it is a problem. Okay, there will be definitely there will be a problem in the growth. It regulates the keep all the body functions in a regulatory manner to bring about a programmed pattern of your life event. See here, you can see oxytocin is a very powerful hormone which is meant for easy delivery of a baby. Oxytocin, all our life pattern. And here you can see the growth hormone. Growth here, estrogen and progesterone are very essential for pregnancy. Here for a delivery, easy delivery, oxytocin is required. And here growth hormone, whenever you want to grow, growth hormone is very required. Okay, you can be grown up and you become an adult. And also it needs again a reproductive system starts here. Okay, various programmed pattern of life events all are achieved by the hormones only. Hormones is defined as a substance, a chemical substance, whatever it may be, or biological substance of a intense biological activity, very powerful biological activity, very intense. Intensity is important. Intensity is the keyword here. It produces very strong action that is produced by the specific cells. This is a definition. Specific cells, all the cells will not secrete the hormones. Specific cells will secrete the hormone and it will be transported through the blood. You can see in this diagram. This is the specific endocrine cells directly secretes into the blood. There is no duct also. And it transport through the blood and it also acts on a target cell only, not all the cells. So what you are concluding here, it shows very strong intense action. It is secreted by only specific cells and it acts on only specific target cells, not all the cells. It is transported by the blood. Like that you can keep in your, this diagram is very important so that you can keep in your mind. This is the blood capillary. Hormones are secreting how here, see, circulating hormones in the blood, it released here and a distant target cell somewhere, this is somewhere, this is somewhere. Okay, this is the having some hormonal receptors will be there on the target cells. Okay, so hormones go and react with that corresponding receptors and it shows very powerful intense action. See, in the examination, definitely this is a number of times it was appeared. Name of the gland and corresponding hormone. Which gland secretes the which hormones? That is very, very important, right? That's why in competitive examinations, in regular examination, it is very, very important. So we will start with the pituitary gland. So hypothalamus, I will tell you while we are studying in the pituitary hormones. Okay. First one, pituitary gland is divided into two parts, anterior, posterior. Anterior releases the growth hormone, very important for your growth, and prolactin, Adreno Cortico Troic Hormone. It is also called as a ACTH short form, Adreno Cortico Troic Hormone. Corticotropin also, it is other name, synonym. Thyroid Stimulating Hormone. See, don't get confusion with the thyroid gland. See, this is different. This hormone is different. This is hormone secreted by the anterior pituitary, which shows action on the thyroid gland. That's why the name thyroid stimulating hormone, that stimulates the thyroid gland. Okay. This is also called as a thyrotropin. Thyrotropin. Next is gonadotropin. Gonads. Follicular Stimulating Hormone, FSH, and Luteinizing Hormone, LH. All these hormones and all we will see separately in the, all these are the separate chapters. Pituitary gland is one separate chapter for you. Thyroid is one separate chapter. Parathyroid is one separate chapter. So we will discuss all in separately, all hormones. Here overallly we will see what is the endocrine system, what is the name of the hormones, that and all only we will see. The remaining jobs, functions of the corresponding hormones, it will be there in the next chapters. Pancreas, parathyroid hormone, parath hormone. Thyroid gland T4, thyroxine, triiodothyronine. See here, name itself indicate triiodo, 3-iodo. That's why here T3 is there. Here thyroxine. X is the important word here. X. X is having a 4 ends, 1 end, 2 end, second, third, and fourth end. That's why it is indicated as a 4. Like that you can remember. Okay. Thyroxine. Most of the students are confusing. Thyroxine is T3, T4, T2, T1. Okay, thyroxine, X is there. X is having a 4 ends, 1, 2, 3, 4. Okay, triiodothyronine, it is having a 3. And also calcium, very important one, calcitonin, not calcium, calcitonin. Here it will, thyroid gland will secretes. Pancreas, islets of Langerhans. These are the cells which are present in the pancreas. It secretes the insulin, very important for diabetic patients. Insulin, okay, and glucagon. Next is adrenals. Cortex. Adrenal consists of three parts. Here only two parts I mentioned here. Cortex, glucocorticoids, mineralocorticoids. Okay. Example also I have mentioned glucocorticoids, hydrocortisone, mineralocorticoids, aldosterone, sex steroids. Okay. Dehydroepiandrosterone. Okay. Not much important that one. And medulla. Medulla consists of adrenaline, noradrenaline, very powerful. Sympathetic system, you can study adrenaline, noradrenaline. Also called as epinephrine, norepinephrine. All are same. Adrenaline, noradrenaline, epinephrine, norepinephrine. Next is gonads. Okay, reproductive system. Androgens secretes the testosterone in the male. Estrogen, estradiol in the females. Progesterone, progestins in the females. So all these we will see in a separate chapter. Only we will see main parts. Yeah, here we can see exactly where is your pituitary gland. You can find here. Okay, exactly. So here you will wear the kumkumandal. Here will wear, and here this is called a Brahmarandra. I will give a devotional touch also. This is a hypothalamus. This part you can see the hypothalamus, and this bud-like structure, it is a pituitary gland. Exactly color, size, shape looks like this. A single groundnut, single peanut. Exactly. Size, shape, weight also. So you can feel that. See the color, pink color, here also pink color. Exactly, you can feel that there is a peanut inside your brain at the center part. Okay, it is a pituitary gland. That's why I mentioned here peanuts. Yeah, this pituitary gland is divided into two lobes. See, first lobe is called as a anterior pituitary, whereas a second one is called as a posterior pituitary lobes. Okay, why this lobes? Anterior pituitary means where it is. Anterior pituitary lobe, it is towards your eyes. Anterior, front. Posterior means backside. See here, you can see this is your backside. Here, this part you can see as a posterior gland, and whereas a front one, anterior. Just like a your peanut having a two lobes. Each peanut having a two lobes. In the same fashion, it is also having a two lobes. One lobe will be towards your eye, anterior. Second lobe is towards the your backside. It is called a posterior pituitary gland. This anterior pituitary gland is very rich with the blood vessels. Number of times it was appeared in the question papers. Blood vessels. That's why here see the red color, pink color, blood vessels you can see here. Which part, which lobe consists of very rich with supply with the blood? Anterior. Whereas a posterior, it is very rich supply with the neurons, nervous system. That's why I shown in a green color or blue color. It is called a posterior pituitary. You just imagine backside of your brain is very rich. Brain is at the backside, not here in towards your face. It is backside. Posterior lobe is also at the backside. That is having a well connection with the, like that you can remember very easily depending upon its position. Neurons you can observe here. These neurons. See the color. Here also color. See, anterior pituitary gland secretes the growth hormone. First Growth hormone, very important for your growth. Next is thyroid stimulating hormone, which stimulates the thyroid gland itself. Adreno Cortico Troic Hormone, which stimulates the adrenaline gland, which is there on the kidneys. Next is luteinizing hormone, follicular stimulating hormone, which stimulates the ovaries. See, all there, it go and react with the target tissue. See, target tissue is somewhere, secreting gland is here. It travels through the body. See how the connection was there in the body. And prolactin is also one of the important hormone which is secreted, responsible for the production of the milk, secreted by the anterior pituitary gland. In the exam, this is very important. Name of the hormone, what is its job, secreted by which cells. Posterior pituitary gland secretes the oxytocin, easy delivery of a baby, oxytocin. You can take a breath of oxygen whenever you born immediately on the earth, no? Oxygen you have to take. Like that you can remember. For easy delivery of a mother, oxytocin, injections they are giving during the delivery. Doctors are giving an injection to the pregnant ladies for easy delivery, oxytocin. You can breathe, take a breath of oxygen after delivery. Like that, easy connection is there. ADH, ADH, anti-diuretic hormone. Here you can see anti-diuretic, which is works against the diuretics. Okay, that point you can keep in your mind. These are the two. Okay. Yeah, next gland is the thyroid gland. Exactly, it looks like a butterfly. Feel butterfly is there here on your neck. Okay, thyroid gland is very important, very big chapter also. Actually, it is very big chapter. Exactly, you can find the here. You can see the butterfly here like this. Thyroid gland. On the thyroid gland, there is a parallelly some nodes are there. See here, node 1, node 2, node 3, node 4 there. Actually, thyroid gland is having a two lobes. Okay, but keep in your mind, thyroid gland is a commonly secretes the hormones, whereas in pituitary gland, anterior lobe secretes the separate hormone, posterior gland secretes the separate hormone, whereas in thyroid gland it is not like that. Entire thyroid gland secretes the two hormones, thyroxine, triiodothyronine, collectively called as a thyroid hormone. Calcitonin is also released by thyroid gland, but we are not calling it as a thyroid hormone. Whenever a thyroid hormone comes, only two names keep in your mind, T3, T4. Calcitonin secreted by the thyroid gland, but we are not calling it as a thyroid hormone. And parathyroid hormone. So two lobes will be there. These are the commonly secretes, the T3, T4, calcitonin. On the each lobe, right lobe and left lobe, parathyroid, some nodes are there. These are called as a parathyroid glands. It secretes the parath hormone. Why this para name came here? Paragraph, parallel, like that. See here, 1, 2, 3, 4 are there parallelly each other. That's why it is called a para, parallelly is there. On the thyroid gland, it is present. That's why it is called a parallel thyroid gland. Pancreas. Pancreas, very important point is there. A number of times it was appeared in the question papers. In the GPAT, okay, PG set, mixed gland. We are calling it as a mixed gland because pancreas, it consists of both exocrine system, endocrine system. Two things are there in the pancreas. That's why mixed pickle. It consists of all the pickles like that. Exocrine and in the examination they asked which gland consists of both structures, endocrine as well as exocrine. It is a pancreas. This secretes the islets of Langerhans, secretes the insulin and glucagon. Exactly here you can find the pancreas in the curvature. Here you can find it. Okay. On the lower curvature of your stomach, pancreas is there. This pancreas consists of all these violet color cells. See here, how many cells are there? This violet cell is called as a islet of Langerhans. This islet of Langerhans, one of the violet I enlarged like this. So it consists of three cells, mathematics, alpha cells, beta cells, delta cells, three cells, alpha, beta, delta. Again mathematics here 10. Okay, it is a mixed pickle. It consists of both endocrine, exocrine, and it consists of a mathematics, alpha cells, beta cells, delta cells, insulin, glucagon. Here you can see the insulin structure. We will read it in separately, no problem at all, in separate. And this is a glucagon hormone, very important for metabolism of the glucose. Yeah, this is the pancreas, beta cells, alpha cells. Insulin, glucagon, exactly opposites. Insulin is very important for the breakdown of the sugar or carbohydrates. Glucagon is responsible for the production of the sugar in the body. Exactly opposite that you have to keep in your brain. Diabetic patients, because of high sugar level, they are taking the insulin, so that we can easily remember insulin breakdowns the sugar. Glucagon produces the sugars. Pancreas is a mixed gland, mixed pickle. Exocrine part, acne, produces digestive pancreatic enzymes. This is very important. Exocrine part, endocrine part. Endocrine part only secretes the hormones, not exocrine part. Exocrine gland produces the digestive juices, digestive pancreatic enzymes. That point you have to, because it is present just below the stomach curvature, it releases into the intestine. Okay. Gastric juices. So it becomes alkaline in nature. All are alkaline in nature. Next gland is adrenaline gland, which renal is the keyword here. Just it looks like a samosa. You can see, you can feel that samosa is there on each of your kidney, and it looks like triangle. It consists of mainly three parts. First one is outer part, is called as a capsule. See, this is first one, outer part, capsule. And inner part is called as a, which is present at the middle, medulla. See, name itself indicates medulla, which is present at the middle. This is the inner part. Whereas this part, light brown color, which is present between the capsule as well as the medulla, is divided into three parts. Zona glomerula, it is called as a adrenal cortex. Adrenal cortex. Zona glomerulosa, zona fasciculata, zona reticulosa. These three are the important parts of the adrenal cortex. Okay. And here some of the mentions I have mentioned here. Catecholamines, adrenaline, noradrenaline, all these are the catecholamines secreted by this part, medulla. Whereas aldosterone, secreted only outer part, capsule part will secrete. This is also very important. Capsule part secretes the aldosterone, which is important for the reabsorption of various water, etc. and all in the kidney, because it is very near the kidney, on the kidney. Capsule is there just having a direct contact with the kidney. Like that you can remember. Aldosterone will act on the kidney, nephron. And androgens, this part secretes the androgen, and this part secretes the cortisol, medulla. This one, adrenal cortex. See, here I have mentioned adrenals. Cortex will secrete the glucocorticoids, hydrocortisone, mineralocorticoids, aldosterone. This is also important in examination. Hydrocortisone belongs to glucocorticoids. Okay. And because name itself indicates hydrocarbons, like that you can remember, hydrocarbons, HC. Sex steroids, diphenhydramine, adrenaline, noradrenaline present in the medulla. And gonads. Androgens, this is the male reproductive system. Androgens called as these are called as a male gonads. Testis, this is the testis, produces the testosterone. Name itself indicates testis, testosterone, males. Whereas a female reproductive system having a two hormones, one hormone extra than that of the male. Male is having a only one, whereas a female is having a two important hormones, estrogens, progesterone. These are secreted by the ovaries. Okay, it is a female reproductive system. You can see the uterus here. Okay, and various important functions of the body, hormones function. This is the hormone names, very important. Hormone names corresponding job. This is overall I am showing. It comes in the separate chapter seal. Very key functions, very key job it does. And site of action of all hormones overall. This is a separate, it comes in the separate chapters. See, site of action, mainly three sites it selects. On the cell membrane here. You can see the cell membrane here. It acts on the cell membrane receptors. Next is cytoplasm, inside the cell, cytoplasm. Next is nucleus, inside the nucleus. So these are the hormones which acts on a cell membrane. This table is very important. These are the hormones, steroidal hormones, all corticoids, which acts on a cytoplasmic receptors. Thyroid hormones, very important. It acts on the genes, tRNA, mRNA, nuclear receptors. It enters, penetrates into the nucleus and it shows its action. Very powerful. Only broadly I have given in this slide, and in the next video we will continue with the remaining topics, right? Thank you. I will end my session here. Keep watching my playlists. I have mentioned okay, all subjects in a subject wise.